Cervical Movement Control Dysfunction Test, guided by Dr. Seshna Rathod Ma'am, made by Deepika Ratwa and Shruti Sadrakia. Introduction. Cervical movement control dysfunction test is defined operationally the presence of aberrant or uncontrolled movements of the cervical spine which observed during the prescribed active movements of the neck and upper limb. Subjects in this group could not suffer from any musculoskeletal condition affecting the upper quarter region, that is, shoulder, elbow, or wrist pain. Cervical movement control dysfunction test requires movement or weight bearing of the upper limb. Contraindication: cervical spine surgery, cervical radiculopathy, severe systemic disease, that is diabetes, fibromyalgia, or other widespread musculoskeletal pain syndromes, that is chronic fatigue syndrome. Cervical movement control dysfunction test includes active cervical extension in 4-point kneeling, active upper cervical rotation in 4-point kneeling, active cervical flexion in 4-point kneeling, active cervical extension in sitting, return to neutral from the cervical extension position in sitting, active bilateral arm flexion in standing, rocking backwards in 4-point kneeling, active unilateral arm flexion in standing, and active cervical rotation in sitting. Movement control test. Active cervical extension in 4-point kneeling. Muscle or direction of movement control. Bias towards semispinalis cervicis or multifidus, which act only on the cervical spine, and against superficial extensors, which also extend the head. Correct performance. Patient is able to dissociate mid-lower from upper cervical extension. Head remains in a neutral position while performing mid-lower cervical extension to about 20 degrees. Impaired performance. Patient is unable to dissociate mid-lower from upper cervical extension. The patient cannot reach 20 degree of cervical extension, or patient adopts poor coordination strategy and uses superficial muscles excessively, indicated by craniocervical extension, poked chin, and excessive use of semispinalis capitis muscle. Active cervical extension in 4-point kneeling. Instruction: imagine you have a book between your hands. Look down to flex the head and neck together as far as possible, and then curl your head back up as far as you can, but maintain your eyes on the book. Movement control test. Active upper cervical rotation in 4-point kneeling. Muscle or direction of movement control. Bias towards the suboccipital rotators. Correct performance. Patient is able to dissociate upper cervical rotation movement from the movement of mid-lower cervical region. No motion of the mid-cervical spine occurs. Impaired performance. Patient is unable to dissociate upper cervical rotation movement from the movement at typical cervical region. Excessive motion of typical cervical region occurs. Active upper cervical rotation in 4-point kneeling. Instruction: rotate the head while keeping the cervical region still as if saying no. Movement control test. Active cervical flexion in 4-point kneeling. Muscle or direction of movement control. Flexor muscles. Correct performance. The flexion movement is predominantly anterior sagittal plane rotation of the head and cervical spine. Impaired performance. Movement. The head and cervical spine translate anteriorly with diminished anterior sagittal plane rotation during the flexion movement. Lower cervical flexion greater than upper thoracic flexion. Active cervical flexion in 4-point kneeling. Instruction: look down to flex the head and neck together as far as you can. Movement control test. Active cervical extension in sitting. Muscle or direction of movement control. Flexor muscles, eccentric control. Correct performance. Head extends behind the frontal plane to 15 to 20 degree. A pattern of smooth and even neck extension of upper, mid and lower cervical region should be observed. Impaired performance, dominant upper cervical spine extension with minimal, if any, movement of the head posteriorly. Active cervical extension in sitting. Instruction: look towards the ceiling and follow the ceiling back with the eyes as far as possible. Movement control test. Return to neutral from the cervical extension position in sitting. Muscle or direction of movement control. Flexor muscle. Concentric control. Correct performance. Return to neutral position starts with craniocervical flexion followed by lower cervical flexion. Impaired performance. Initiation of returning to neutral position with sternocleidomastoid and anterior scalene muscle resulting in lower cervical but not upper craniocervical flexion. Craniocervical flexion is the last rather than the first component of pattern of movement. Return to neutral from the cervical extension position in sitting. Instruction: return to neutral from the cervical extension position. Movement control test. Active bilateral arm flexion in standing. Muscle or direction of movement control. Flexor extensor muscle co-contraction. Correct performance. Cervical spine remains still during 180 degree of bilateral arm flexion. Impaired performance. Excessive forward head movement or extension of the cervical spine observed during 180 degree of bilateral arm flexion. Active bilateral arm flexion in standing. Instruction: raise and lower your arms as far as you can while keeping your head steady. Movement control test. Rocking backwards in 4-point kneeling. Muscle or direction of movement control. Flexor extensor muscle co-contraction. Correct performance. Cervical spine remains in neutral position during the movement. Impaired performance. Excessive cervical extension is observed during the quadruped rocking back. Rocking backwards in 4-point kneeling. Instruction: rock backwards slowly as far as you can. Movement control test. Active unilateral arm flexion in standing. Muscle or direction of movement control. Flexor extensor muscle co-contraction. Correct performance. Cervical spine remains stable via observation during single arm flexion 180 degrees to both the sides. Impaired performance. Excessive motion of cervical rotation or lateral flexion is noted during arm flexion to 180 degrees in either side. Active unilateral arm flexion in standing. Instruction: raise and lower each arm separately as far as you can while keeping the head in neutral position. Movement control test. Active cervical rotation in sitting. Muscles or direction of movement control. rotation movement control, correct performance, a pattern of smooth and even head rotation around a vertical axis should be observed to each side, 70 to 80 degree rotation to each side. The plane of the face should stay vertical with eyes horizontal and with concurrent upper and lower cervical movement. No other components of motion, that is, lateroflexion, extension, or flexion, should be observed. Impaired performance, rotation to either side occurs with concurrent or simultaneous lateral flexion, extension, or flexion and or forward translation of the head and neck. Active cervical rotation in sitting. Instruction: rotate your head and neck as far as you can to each side while maintaining the plane of the face vertical and eyes horizontal.